Hello, it's Dr. Robert Davis with Active Health Knee and Shoulder, and I'm here with Maudood. Maudood was kind enough to come on and tell us about his experience in our office. So, Maudood, can you tell us the problems that you were having when you first came in?
Yeah, before when I heard about your office, I have difficulty walking, especially on the stairs, and more so I was afraid because it used to be pain. And when I bent down to pick up something or to the floor, so I unable to do. I mean, very hesitant, and I felt the pain, so I avoided to do that. So normal activity, bending down or walking and taking some step. So even I do take it was pain, yes.
What did you try before you came in here? What type of
I went
therapies?
to even the doctor's office because my family doctor recommended. So he said maybe you have a water or you had this. So he recommended the injection, which I avoided. Then he said, if this continue, you might have to get into the surgery. So there was not a very good option, those two.
Right.
So that's why I continue to avoid. And then thank God I am able to see your advertisement. On the
Right,
Facebook.
saw the advertisement right on Facebook.
So I think it was a try and it helped me. Thank you.
You're very welcome. So, you've been coming in to see me for probably 2 months now?
Correct, yes.
Okay.
Yes.
Okay. And what would you tell people out there that are suffering with chronic degenerative knee pain, that are facing, like, say, a replacement surgery? What would you tell them to do?
That's true. No, because see what we do when we feel pain, we try to accommodate, and then it's a spiral effect, then you're hurting on bone. So I would say that it's worth a try, and it saves you a lot of pain and anxiety and complicated surgeries.
Yes.
And it's worth a try because it worked out for me. So,
Absolutely.
yeah, it did.
Well, I'm glad it worked out for you. It's a
Thank you.
pleasure having you in the office.
Thank
Thank
you
you.
very much.